We next move over to Professor S Natarajan. Sir is currently the Chairman and Managing Director of Aditya Jyot Eye Hospital. He is the past president of AIOS and he received the prestigious Padma Shri Award in 2013. Sir postgraduated from the University of Madras, did his fellowship in retina and vitreous surgery at Shankar Nethralaya. He is a fellow of the Royal College of Physicians and Surgeons, Glasgow, and a fellow of European Latino American Society of Ophthalmology. Sir has numerous publications and has received numerous national and international awards. It's my honor and pleasure to invite Sir for the next talk.
Thank you very much for having me. And this is my favorite session. And I have my favorite friend here, Santosh. Thank you, Santosh, for a wonderful talk and wonderful work. And I think we all should congratulate the IJO editor for having the highest impact factor in the past decade, I think, and plus the history of All India Ophthalmic Society since 1930. Heartiest congratulations, Santosh.
Thank you.
So, thank you, Santosh. So, can you see the slides? Yeah?
Yeah.
Yeah, okay. Tips and tricks of research publications, ethical consideration, the financial disclosure and plagiarism in publishing research. So the ethical consideration, ethics are norms of conduct that distinguish between acceptable and unacceptable behavior. Ethics are the principles and guidelines that helps us to uphold things. So research ethics involves the application of fundamental ethical principles to a variety of topics involving scientific research. Research ethics educates and monitors a scientist conducting a research to ensure a high ethical standards. So when I became editor in 2011, I learned this, and this was one of the topic which I was making the research methodology workshop. So when you have importance of research ethics, the same thing can be applied for clinical practice, clinical research, and basic science, or anything, I mean, even to life. Respect and cause no harm to the participants. As a sign of respect for other researchers and cause no harm to the participant. It is a professional requirement. It is a requirement to obtain funding. Failing to conduct research ethically result in researcher being dismissed or rejected by the research community. The basic principles of research ethics: honesty, objectivity, the respect for intellectual property, objectivity, confidentiality, integrity, respect for colleagues, carefulness, non-discrimination, openness, social responsibility. Important areas are again authorship, plagiarism, peer review, research with animals, research with the human subject, and research misconduct. The authorship, I think this is the most important for anybody before starting writing anything, whether it's for a peer-reviewed journal or for any of the magazine or even the any journals. Research evolves from collaboration and assistance between experts and colleagues. Authorship is the process of deciding about on who names a research paper belongs. Authorship is reserved for a person who receives primary credit and holds primary responsibility for a published work. It decides which colleagues should be listed as authors or co-authors. And each author should have participated sufficiently in the work to take responsibility for the content. This participation must include conception or design, or analysis and interpretation of data, writing the research paper itself, or all of the above. An acquisition of funding, collection of data, or general supervision of the research group alone does not justify authorship. Order of author names. According to the COPE guidelines, the sequence of authors should be determined by the relative overall contributions to the manuscript. The order of authorship on byline should be a joint decision of the co-authors. An author should be prepared to explain the order in which authors are listed. The first author should be that person who contributed most to the work, including writing of the manuscript, should have conceptualized the design, defined precise method, participated in a major way in analysis and interpretation of results, and written the paper. The lead author, a person who is responsible for ensuring that all other authors review and approve the final version. Co-author should have made significant contribution to the planning and execution of the research, the methods and procedures, the collection and analysis of the data, etc. The group author, when submitting a manuscript, the corresponding author should clearly indicate the preferred citation and should clearly identify all individual authors as well as the group name. How to avoid problems with authorship. And this is the most important. Agree with your team that you will follow the international guidelines. COPE, Committee on Publication Ethics, agree before starting the research. That means when a professor is calling a student or a junior research fellow or a postdoc and ask him to start a research, if he's joining a new organization, who will be an author, order of authors, and if necessary, discuss why each person should be an author, clarify the requirements. And we are doing a extensive research with Cleveland Research, Cleveland Clinic, Cleveland Case Western University, where we actually work for so long and we are very clear who will be co-authors, who will be corresponding author, who will be a lead author, and who is the first author and who is the last author, because even the last author is an important person, maybe the head of the department. But again, if you see in the previous slide, it has to be contribute, not just because it's the head of the department or I'm head of the hospital. And I hate if somebody includes my name and I make sure I withdraw the paper. So the people are afraid to include my name. So you should not be a co-author just for the sake of it, whether you're a head of the department or a head of the institution. And this is for the head of the institute. But as a student, I think you have to find a way how to start working, and you have to probably even choose a teacher who will follow all this. And reviewers can also engage in unethical behavior, bias, conflict of interest, misappropriation of privileged information. And reviewers are obligated to maintain confidentiality, inform the editor if circumstances preclude an unbiased review or could represent even a perceived conflict, provide fair and collegial assessment. Sometimes you may have something as a research idea and somebody is sending. I think you should be really fair with yourself and tell the editor, I will not edit because I have already my idea and I don't want to be a reviewer for this article. And that's a ethical part of the reviewer. So one is who writes it, who's the co-author, who's the lead author, plus the main author and also the reviewer. So financial disclosure, the basics. Goal, reduce potential for bias in clinical studies and enhance human subject protection. Implemented by FDA rules at 21 CFR Part 54, February 298, published in FR effective 1 year later. And the FDA guidance, financial disclosure by clinical investigators, it's dated March 20, 2001. Requirement for any manuscript submitted, disclose data on the financial interest of clinical investigators of covered clinical studies or certify there are no disclosable interests. And plagiarism in publishing research, it's exactly, see, the boy behind is copying. And this is where you should know that just copying is a plagiarism. And the use of word plagiarism in the English language dates back to 1600s. It is derived from the Latin word plagiare, which means to kidnap, the deliberate or reckless use of someone else's thoughts, words, or ideas as one's own without clear attribution of their source. There are a lot of softwares to find out, but still, I'm thankful to many reviewers. I remember withdrawing one published AIOC article where it's about a 15-page article, a basic science article, our own Indian author. He had published in some other basic science or a material science journal, and then he had the same paragraph in his, and then without realizing, he thought probably somebody will not find out. The plagiarism software missed it, but somebody had reviewed and somebody read somewhere and they asked for the article and got back, and we finally withdrew the article. I know it's a black mark for the journal, but it also shows that the editor is following the rules of COPE. And what is plagiarism? There's a difference between deliberate plagiarism and accidental plagiarism. Do you know in law, you can have also a deliberate murder and accidental murder. But do you think you will be not punished for accidental murder? Murder is a murder. So unless you prove some other way that the murder has happened, I think it's very difficult. If you have accepted you've done a murder, you have to undergo punishment. Same thing here. Deliberate plagiarism or accidental plagiarism. Deliberate is rewriting from books or articles. copying and pasting from web pages and online sources to create a patchwork writing, buying, downloading, or borrowing a paper. And that is deliberate. So I think this is what I said. You learn honesty, you learn how to be good in yourself when you're an editor of the journal. And that's particularly an Indian journal, which is there for more than almost reaching 70 years now. So it's great that forefather, like it started by Dr. S.N. Cooper in Mumbai, and I'm glad that IGO was started in Mumbai and AIO was started in Chennai, from where I belong to. So the deliberate plagiarism is, sometimes you say, I don't know, but I want every student, everyone who's attending should know that. And in case you have accidental plagiarism, this happened to our Bharat Ratna CNR Rao. He said, my student has done it and accidental plagiarism happened. And he also said, I don't know that he copied a paragraph from his own article where he was also co-author in a new article. And then the journal, which was a high impact journal where CNR Rao published it, said they will not allow to withdraw the paper. They will say this paper has been plagiarized, and he was punished by publishing that he made a plagiarism, even and mentioning that his fellow did it. But the bad name is to the Dr. CNR Rao. He's a Bharat Ratna, and what an amount of publication. But accidental plagiarism is also not allowed. You will be punished. Not knowing when and how to cite, not knowing how to paraphrase or summarize, not knowing what common knowledge is, and recycling an old paper. So best is the type of plagiarism. There are several plagiarisms. Best is you should know what is plagiarism and you should know how not to do it. It's like having a complication of cataract surgery, and you cannot say, I did surgery, but I don't know that this complication will happen. No, you should know everything. Then only do the surgery. Same thing here. Plagiarism of ideas, plagiarism of text, self-plagiarism, and plagiarism of ideas. An author does not copy any words and phrases from the original article. If he simply uses the same idea, thought, or invention and presents as own without proper acknowledgement. Mosaic plagiarism, borrowing the ideas and opinions from an original source and a few verbatim words or phrases without crediting the original author. In this case, the plagiarist intertwines his or her own ideas and opinions with those of the original author. And
Dr. Natarajan, may I request you kindly conclude?
Okay. In scientific writing, plagiarism is regarded as a serious breach of ethics. Authors have a responsibility to ensure that they make due acknowledgement every time they use ideas or words of others. Editors of scientific journals also have a responsibility to discourage plagiarism. So they are a copyright infringement, plagiarism, and avoiding plagiarism is not always easy, and it is inevitable that so common tips for avoiding plagiarism and acknowledgement. And then you can use a medical writer should avoid writing multiple separate articles if you can present at a large complex study. And confess yourself, last but not at the least, if he feels he has unintentionally used somebody else's ideas or text without appropriate referencing, he needs to write to the editor of the journal for advice. Confession is always better than to be caught stealing. Thank you very much.